First and foremost is, as much as possible, one should avoid sugary, starchy food. So, brushing the teeth or cleaning the mouth, this should be a fun exercise. Children should be seeing their parents when they are old enough, of course. Initially, it should be under supervision.
Hi guys, this is Mindivan and you're watching HealthSite and India.com. Today we have with us Dr. Paramita Ganguly, dentist specialist, Fortis. Hi doctor, how are you?
I'm fine. Good evening. Good to see you. And it's a pleasure to be with you. Thank you.
Same here. Thank you, doctor. Thank you for joining us today. And since it's National Children's Dental Health Month, I think today this is something which is of utmost importance, yet, not really talked on much. The teeth and the gum care for infants and toddlers. And I would request you to throw some light on this. And to begin with, I think the very first question that comes to my mind right now is what causes cavities in infants and toddlers. What is the cause of cavities, primary cause of cavity?
You have said that care of children's teeth is really important, and it is a very, people don't really take it seriously because it's always a thing that what about children's teeth? They are always going to fall off, right? Now, preserve health and to have a good aesthetic value and for a child to be able to speak properly, that is development of phonetics, etc. It is very important that the oral health of children is really looked after. And as far as caries is concerned, the primary cause is same, whether it is in adult or is in children. It is the bacteria which, in addition to the starchy carbohydrate, which stagnate in the mouth or primarily in the tooth surfaces and the crevices, that leads to caries or cavities. This should be diagnosed and treated in time in order to maintain a good oral health.
And since we're talking about the oral health and oral hygiene, doctor, how do infants really maintain their oral hygiene? What can parents do in order to maintain the oral hygiene of this?
As you have said, that it is primarily the work or it is the care given by the caregiver or the parent, and they are the ones who really can look after and see how the oral health is maintained. First and foremost is, as much as possible, one should avoid sugary, starchy food. We should always, when the child is, say, about 3 months old, one should start, trying to clean the oral cavity, say with a damp cloth or a clean, wet cloth, and make sure, we start making this a routine. As the child grows older, it is from the parents or the caregivers they learn their first lessons. So, brushing the teeth or cleaning the mouth, this should be a fun exercise. The children should be seeing their parents when they are old enough, of course. Initially, it should be under supervision. The moment their teeth start erupting, one should use a small, soft baby brush and very little paste, say the size of a rice grain, to brush their teeth. And always make it a point to not to give a child too many sugary, even juices, etc. Not too much of that. Make them have a habit of drinking water. These are the things one should start in order to maintain that children have a good oral health. Because once a cavity happens, then there is no going back.
Having said that, doctor, since we're talking about sugary elements and sugary stuff, it's also said that the breast milk also has a natural sugar to it, right? So can breastfeeding in any way lead to cavities?
Breast milk per se does not alone cause cavities. If the milk remains unswallowed overnight or over long periods during the day in the mouth, it may predispose the teeth into having cavities.
And if we talk about, since we're talking about oral hygiene, so when should a child really start using a toothbrush, or perhaps when should the parents induce the habit of toothbrush for their child or infants?
The moment the teeth start erupting, that is, say, 6 months of age, approximately, the incisors, the deciduous or the baby teeth start erupting. That is the time one should start the habit of making the child brush their teeth. And this should be till the age of 3, 4. It should be under parental supervision, because the child does not really know how to rinse. Most children, tend to swallow the paste. So during this period, it should be that a parent or a care provider is, assisting the brushing. Say from the age of 6 months, the child should start brushing their teeth and use very little paste, because most of the children's paste is fluoridated. So from 1 year or 2 years of age, it should be just very little, say about size of a rice grain or something like that. Once they are over 1 year of age, then you can gradually increase the amount of paste.
But also, is there anything that the parents can do from their end before the teeth even comes in terms of taking care of oral hygiene?
Yes, ma'am. The gums need to be, in fact, the gum care should be happening right from the initial part itself. That is after every meal, especially after milk and etc. After every meal, the gum should be cleaned with a soft gauze. It should be little damp so as to not be hurt the teeth. One can also use a soft brush, but maybe the brush at times might cause little damage to the gums, and the child may not be able to, or the parent may not be able to understand that. So it's always better with clean hands, take a small piece of soft damp cloth and clean the gum, so that no residue of food etc. is stagnates or is left on the surface of the tongue, on the gums. Because children, as you know, they are our most precious and they are our future.
That's true, and beautifully put together as well, Doctor. Thank you so much for joining us today. This was wonderful. Thank you so much for sharing all your valuable insights.